Hey guys, so I have been asked numerous times about how to deal with times when a resident refuses care. So this could be honestly not even just a resident, this could be for a patient in a hospital. For those of you who don't know, if you work in healthcare, normally people that live in nursing homes are termed residents, and people that are receiving care in hospitals are termed patients. So just to kind of give you that idea. Also, I've worked at assisted living facilities before where people that lived there were termed clients. It kind of just depends on the company policy. Now, there are numerous reasons why someone might refuse treatment or refuse care. So you have to remember, one of the most important things to remember is that they have the right to refuse care or treatment regardless of the reason. Now, obviously, there are certain situations where if somebody has Alzheimer's or dementia, or they are confused, they don't really know what's going on, there may be a situation where that particular person is refusing care. And really, it's more of a health issue if you do not provide the care that they are refusing. For example, if you need to change Miss Betty and she has dementia and she doesn't want you to touch her whatsoever, there is definitely an issue that could come up from you not providing that care to her, the care being changing her. So there are a bunch of different things that you could do. There's different options that you have. So things that I have tried, particularly in the memory care setting, is, or even just with patients who are confused or combative and they really don't want you to do whatever it is, more specifically in the terms of changing someone, because that is the one thing where it's like the main thing that residents don't want you to do, especially when it's confused or, it's a person who is confused or has dementia. They do not want you to change them for whatever reason. And so what I always did when I was working in the memory care setting is I would approach them to provide the care. I would, come at them in a very calm, quiet tone and demeanor. And I would let them know, hey, Miss Betty, do you need to go to the bathroom? I would not start off by saying, we're going to change you, because a lot of times just hearing those words, a lot of my super combative memory care residents, they like those words just kind of clicked in their head and they would start getting really combative. So if I came at them from a different aspect of things where I asked them if they needed to go to the bathroom, sometimes they'd say yes, sometimes they'd say no. Really, when you work in memory care, you really shouldn't ask them if they need to do something. You should approach them from like, oh, hey, Miss Betty, why don't we go to the bathroom before you go to dinner or something like that, or before you have lunch? Let's go to the bathroom just in case you have to go. And sometimes it's just approaching things in a different way like that that can really help you, especially if you have somebody who's combative or confused or with dementia. So if Miss Betty still refuses at that point, then I kind of back off. I say, okay, well, I'm going to go, and I will come back and I'll check on you in a few minutes or a little bit. And then I will come back. I'll usually give them like 5-10 minutes, sometimes 15 or 20, depending on how combative the person is. And then I will come back and I will try again to get them to go to the bathroom so that we can change them. I do not, normally if it's somebody with dementia or somebody that is getting really combative, I don't, like I said, I don't come at them saying, oh, we're going to change you. I usually try to say, let's go to the bathroom just in case, and I will try to let them know that, once they go to the bathroom, then we can go here. It's kind of like a similar way to approach students in a special ed setting. First do this, and then we do a lot of that in special ed. So, normally I will approach them a second time. Now, if after that second time the person is still refusing, I back off one more time. But usually if they refuse a second time, that's when I get the nurse involved. Just because sometimes having a different person come in and try can sometimes be all they need. Sometimes, you might be the bad guy and have the other nurse come in, or have the other CNA come in even, and try to get them to the bathroom so that they can be changed. Because it's not good for somebody to sit in a wet brief, for an hour, 2 hours, 3 hours, however long. And it's really not good for their skin. It's not good for them. So it really needs to be done. Sometimes other CNAs are not willing to like tag team like that, where, if you have a problem with one of your residents, then, you can go to the other CNA and ask for help, or ask them to like try to change this person for you. Because sometimes, I don't know what it is, sometimes like, especially with dementia patients or residents, it's like seeing your face, seeing a new face can help them be more accepting of the care, especially when they're in that combative mode. So normally, like I said, if they refuse that second time, I will get somebody else involved, or I will let them know, hey, I've tried to get Miss Betty to go to the bathroom or to get her changed or whatever. And I've tried twice now and she keeps refusing. So do you think you could go and try and see if you have any luck with it? And sometimes it's to the point where, like with a shower, sometimes you just have to write that they refuse. I will normally try 3 separate times, and hopefully by the 3rd time, I'm able to get them to comply at least in some way, or get someone else involved who can help them, receive the care that they need. But if it is a person who is not confused, does not have dementia or does not have Alzheimer's, they have the right to refuse any treatment or care. If the person is refusing to get changed and you know that they are wet, definitely make sure that you let the nurse know or your supervisor know, whoever that may be. But the nurse can also ask them questions like, do you understand what that means if you don't get changed? Do you understand that by sitting in a wet brief like that, you can actually cause harm to your skin? You can get a UTI, things like that. Like, sometimes the nurse just has to come in and provide education, and the person may not be happy about it, but they may comply. Sometimes they're just not going to do it, no matter who is talking to them, no matter what may happen to them if they don't receive the care. It just depends on the person, but they do have the right to refuse care. And I think one of the most difficult things for me when I was working in the nursing homes was having different nursing staff, like nurses, not CNAs, come and like try to force people to do things. I mean, there were CNAs that tried to force people to do things also, but you also have to realize that these are people. They have a mind of their own. They are able to make their own decisions. Like I said, there are certain cases, like if somebody is confused, has dementia, has Alzheimer's, then they may not be able to make those decisions for themselves. But normally, if a person has dementia, you will know that they have dementia, and there will be some sort of protocol in place for dealing with that person, or caring for that person, I should say, not really dealing with that person, but for caring for that person, if they choose to not accept care. I know at certain memory care facilities or on certain memory care units I have worked on in the past, it has been something as simple as, if you don't take a shower, then we'll have to call your daughter and she'll have to come in and talk to you. And sometimes that's all you would have to say, and they would just get right in the shower because they felt like they would be in trouble, or they felt like they didn't want to get their daughter involved or their son or whoever. I don't know. I've also tried where this was actually recommended to me by the nurse. So don't take this as being crazy or like super rude or dishonest. but the nurse used to have me give a shower to this one lady, and every single time you always had to tell her, regardless of who it was giving the shower, you always had to tell her, well, we want you to take a shower because your daughter is going to come see you, and she doesn't want you to be wearing the same clothes that you were wearing before or yesterday, and she wants you to make sure that your hair is clean and that you smell nice, because if she wants to take you out for lunch, then she's not going to be able to if you don't take a shower, or something like that, some situation like that. Sometimes her daughter would come in, sometimes she wouldn't, but that was the easiest way to get this woman to take a shower and to change her clothes and to do a lot of different things. So anyways, I hope this was helpful. If you guys have any other like CNA related questions, memory care related questions, medical assisting related questions, phlebotomy, pre-med, all that stuff, if you have any questions like that, please let me know. If you have any questions about paraprofessional or special education, please let me know that as well. Any topics you'd like me to address in the future on my channel, let me know that as well, and I'd be glad to get something filmed for you. And with that being said, that's all I have for today. I hope you guys are having a wonderful day, and I'll talk to you guys next time.